Hi, I'm Liz Cortez with Business Trends TV, and today I'm joined by Dr. Lysandra Estelle over from Manhattan. How's it going?
Hi.
Great. Thank you so much for being on our interview today. Just so that you know a little bit about Dr. Estelle, is she has been practicing since the 2000s, and she's practicing general, cosmetic, implant dentistry, and she currently is in the Army Reserve and is a dentist for the Army as well. So I'm excited for this interview today, and today we're focusing on how to update your look. So I know right now we have a man that's watching this video, or even a woman that's watching this video, and they want to know how can they easily, update your look. What's your advice, Dr. Estelle?
Well, first, you want to get a good doctor. How do you find a good doctor? Generally through word of mouth. You can go up to friends that have great looking teeth and you can ask them what they do and who's their dentist. And you can start that way. And then also, once you do find the doctor and you feel comfortable with them, generally most doctors will do a complimentary consultation, as what we do here. We do a complimentary consultation and give you an overview of some things that can enhance your look or update it. By updating, most people think it's a total overhaul of things that are existing. Sometimes that is necessary because in the past 5, 10 years, new materials have come out that are much better, more lifelike, and even longer lasting than what's there now. And sometimes those large silver fillings that people may have, they definitely need to be replaced for preventative reasons before something major comes along that's even more costly. And speaking of the cost, it's not as expensive as what it has been in the past because it was rarely done. But now, since it's more commonplace to do these procedures, the cost has dropped significantly. So just talk with your doctor. There's tons of payment options out there, and find which one is going to work best for you. And that's some of the methods that you can do. Well, we really start off with just whitening. Whitening does tons, but before you get whitening, you must get your teeth clean. You just can't whiten on top of stuff that's not going to whiten. So you need to find out what is going to whiten. And then there's also and the different types of whitening: the in-office, the take-home trays, and then the pre-gel strips. The strips, they work, but you really want to get them from the doctor because they're higher concentration than what you get over the counter. Most people have concerns about, is it going to damage my teeth? No, it doesn't damage the teeth. The reason most people have sensitivity is because you need to talk with your doctor first. That's why you just can't do it yourself. You may have some cavities that are very sensitive to this material, and you may have some recession due to periodontal disease that you need to have under control before you do that. So it's not just you're going to do it yourself. It is you have to talk to the expert so you can find out what's going to work best for you. Then there is just changing out some of the fillings. You may not even notice that some of your fillings could have broken or fallen out, and you're just thinking because you don't have any pain, you don't need to go to the dentist. Well, that's not always the case because sometimes the fillings may not be as extensive that it involves a lot of the tooth surface that does have sensitivity. So you want to just, again, go for your regular checkups with your doctor, have them evaluate, and if you find that the doctor doesn't want to talk about cosmetic or says you look fine as you are, I would go to another doctor because everyone can always use some improvement. There's something, maybe the doctor isn't comfortable with doing that, and so you just need to search around because you will be able to find the doctor that is the best fit for you. And then lastly, you may also need to do a complete overhaul. Let's say you don't have any teeth and you're wearing dentures, those removable bridges. There's modern techniques out there that make them more lifelike and much more adaptive to your gums. If you had them for 50 years, they need to be changed. Most dentures need to be replaced every 5 years or so. And you definitely need to don't think that just because you have these false teeth that you don't ever need to go to the doctor again. No, you could have some undiagnosed conditions, and again, the longer you wear that, the more damage it could be done if it's not monitored. So that's a few of the quick steps that could be done that's very stress-free, non-traumatizing, and you get to see your doctor and see what's the latest things out there.
Oh, that is excellent. So just the big takeaways is first go see your doctor. Don't try
Yeah.
things out yourself. You know, you may be having some stuff going on with your gums or your teeth that your doctor's going to be the expert. They're going to know what's going on. If you really want to update your look, make sure you go and see a doctor that does that, because your regular dentist may be like, oh, you're fine, don't worry about it. But if you want to feel great and look great, there's nothing wrong with like doing a little update right there.
Right.
So thanks for giving those different scenarios depending on where, you know, the person is watching this video, whether they just want to whiten or maybe they have full reconstruction that they want to do and update their dentures. And so that kind of leads me to my next question, which is, you know, when going online and looking for, you know, a cosmetic dentist, I mean, what advice would you give to the person watching this video right now when they go online? Where should they go look to choose a good
Okay, if you're going to go online and look, yes, look under cosmetic dentist. Look under, also go to specific websites for what you think you may need. If you think you need veneers, there's tons of veneers. If you've heard of Lumineers or some of the advertisements that are there on TV, Lumineers, Snap-on Smile, all these other things, you can go to those specific websites, and the doctors will be listed on those websites also. If you put in the zip code and find which one is affiliated with doing that type of procedure, and you can find one that's close to you, although I don't mind you coming to New York, but you can definitely find one close to you. So that's the best thing. Again, go to the website, look for the specific type of veneers or things that you want to have done. A good one is, like I said, Lumineers, Snap-on Smile. Snap-on Smile is great because it's just a mold of your mouth, and you can get a trial simulation of what a complete overhaul of your mouth will look like, and you'll get to try it out. And once you feel comfortable with how you look, then you can go ahead and do more steps to get that look more permanent for you. One thing also, when you do these new looks, they are great and they are very life-changing for you, because even just whitening, I've done tons of patients that have had whitening done. We've done a couple of veneers, and they're in the beauty industry themselves, and they couldn't believe that they thought they were fine. But once we tweaked their look a little bit, and this was a guy, and once we tweaked his look, he's just amazed at how many people, women, and some, you know, men fall under his spell and hang on his every word ever since he's updated his look. And he constantly calls me and is like, he just never knew that the simple things that we did, changing a few silver fillings out to the tooth-colored fillings, fixing one tooth that may have been a little smaller than the other tooth with a simple chair-side veneer, which is a facing. I like to liken it to a press-on nail. It's just a simple prefabricated shell that's pretty generic, and we customize it to fit you that day in the office, and you walk out looking totally different. So it is as simple as that, and it is as fast as that. So, and it is across the board for men and women to get done. But again, you can start on the website, word of mouth, look in the paper. There's tons of advertisements in the paper. Listen to, go to YouTube and look at some videos on YouTube for cosmetic dentists and find one that's going to work for you.
Oh, that's excellent. Great advice there. How to choose the best cosmetic dentist for you. And what I hear from, you know, your practice is that everything is really customized. It sounds like, I mean, just from talking to you, you make the patient feel really comfortable, and you know, you want to make them look beautiful and feel confident. So that's what I was hearing when you were sharing that example from your patient, is that by just updating your look, doing a little bit of whitening, fixing a tooth or so, and just really making them feel great. That's what happens at your practice. Why don't you share a little bit more about, the experience when someone comes to you?
Okay, so when someone comes to me, they really enjoy it. I get lots of compliments before we even leave the office and finish the work. I'm getting lots of compliments, and it's not anything that I'm twisting the patient's arm. You better give me a compliment. No, it's just it's just something that they feel. Everyone is different, and I'm very adaptive to how patients are. The best patients that I have are the ones that were very dental phobic, and now they are my best patients because they're calling me exactly 6 months, to the T. My appointment is this month, doc. I need to get in, and I'm like I can barely, you missed about 4 appointments before you started coming, and now once we got you in, they never miss an appointment, and that's a testament to the type of service that I provide. I don't rush you. I spend time with you, and that's also maybe one of the downsides is that I do spend time with my patients because being here in the heart of Manhattan, in Midtown Manhattan, everyone wants to get done on their work, their lunch hour. So I do get you done on the lunch hour, but there's some procedures, and I understand that because we do have to be very efficient and get them in and out and looking like nothing ever happened while they were away at lunch. And so we do make that happen. And sometimes the procedures, if they're a little longer, that's another good thing about my office. We also stay open late. We're here till like 6:30, 7 o'clock at night. And for our very special patients, we do accommodate them and come early in the morning also. But that's only for the patients that have been vetted, I'll say. Tried and true patients. If you're a new patient, you're not getting that luxury.
Yeah, man, early morning, late at night. Now that is service at Manhattan Dental Enterprise.
Yeah.
That is excellent, excellent. So my next question is, for a person that's watching this video right now, they're a new patient. They're, got to be vetted, and you'll make them feel comfortable when they make that appointment, come in for their first, appointment. How's the best? I mean, do you have any special offers for new patients, or how do they get a hold of you? Where do you want them to go to schedule their appointment?
The best way to reach me is definitely through the website because I'm connected to my phone. Even my staff is connected to my phone. We have several different ways to get a hold of you. And the internet and email is the best way to get a hold of our office because people are always like, the phone is always literally ringing off the hook. So we can respond faster with email. We're in Midtown Manhattan. We're right at Grand Central, so it's the 4, 5, 6, 7 train or the VD train. When they come in, we do offer complimentary consultations if you want to do an analysis of how you can update your look and what needs to be done. I mean, literally, we will sit down, talk with you, let you know, like, this could be done, that could be done, and when do you want to start? If you don't want to start, we don't pressure you to start the same day. When you're ready, you're going to take the leap and be ready. And if you don't choose us, we don't mind. Our philosophy is we want you to be the best you. So whether we do it, whether somebody else does it, it's still something that is recommended for you to get done. And I'm also locatable through the state of New York. I've had people call the state of New York looking for me, patients from 5 years ago when I was in a different location. So I can be found.
Excellent. Yeah.
And when you find me, I will see you. I definitely will see you. That's not a problem. You will get seen, and you will. It will be a great experience, and we'll have a great time.
Excellent. So I put up your phone number right here below my video right there. There's phone number. Here's the website. And you can also click the link right below this video. And that will take you directly over to Dr. Estelle's website so you can send an email and book an appointment for your first consultation. So thank you so much, Dr. Estelle, for doing this interview and educating us how to update our look and just easily and really simply. And so this was a fun interview, and just thank you for taking the time to do this.
No, thank you, Liz. Thank you so much, and I look forward to doing another one.
Yeah, sounds good. I bet the person watching this video wants to hear some more interviews from you too. So thank you. Bye.
Okay, bye.
Great job. We did have a couple people. I see you right now watching our video. So hello to whoever's watching. Doesn't say your name, but I do know someone's watching right now. Who did you email the link out to? So we had two people on. The other one just jumped off. But that was cool. So you really did do it live. People were watching you live the entire time.
That's great. Because I know, hopefully it's just my sister and one of my patients that was like, what? She was like, what channel are you on? I was like, okay, it's not a channel.
We're on a live Google Hangouts.
Yeah. I was like, no, I'm going to send you a link, and you can watch it there.
Aw, that was excellent. So right now I'd love to just get a quick video testimonial for you just to share about, your experience learning how to do the Google Hangouts and, just sharing about, working with Business Trends TV or myself. You can share just your name and then share where you are, what benefits did you receive, and then why would you recommend other people doing Google Hangouts or filming videos like this. So I'm going to put myself on mute, and you can get started whenever you like. While you're recording, I actually have to go grab my charger because my computer is going to die soon. So start whenever you like, and I'll be right back, okay?
Okay. Hi, I'm Dr. Lysandra Estelle. I'm in New York, New York, and I really loved working with Business Trends TV. Liz was excellent, very informative, and very helpful. What I enjoyed about using Google Hangouts is that, one, I've only just recently heard about Google Hangouts and the scope of what it does, and now seeing it live, it is really highly interactive and effective, and I would recommend everyone to use Google Hangouts. It's going to be our newest way to even communicate with our patients that want to talk more and they can't make it because, they're home and they had a overnight emergency and it's a Sunday and we won't be able to see them until the next day. So using Google Hangouts is added benefit to our office. Okay.
Perfect. That was perfect time. I could still hear you. I just had to go grab my charger. Ooh, man. Yeah, I didn't have it plugged in that whole interview and almost used up half of my battery on there. But excellent. So I'm going to stop broadcasting right now.